Cardiac rehabilitation provides a safe environment for patients to exercise, learn about risk factors of heart disease, and ultimately to prepare patients to return to work. As advocates for individual patient needs and goals, cardiac rehabilitation can serve as a liaison between a patient and their physician for return to work with clinical information about the patient's current physical abilities. Cardiac patients don't look the same as they used to. They don't act the same either. The main goal of generic traditional cardiac rehabilitation is to assist patients in developing a healthy lifestyle plan. But 20 minutes on a treadmill and another 20 minutes on a bike and lifting small hand weights is likely insufficient for someone with a physically demanding job or someone who regularly participates in active, challenging sports. Cardiac rehabilitation has not changed in the past 30 years, but our patients have. Today, a patient who has experienced a heart attack or other cardiac event is just as likely to be an active 38-year-old as it is a 75-year-old retiree. Because of these changing demographics, patients who seek cardiac rehab have a wide range of lifestyles and activity levels. To address this diversity, Baylor Hamilton Heart and Vascular Hospital has designed an approach to rehabilitation that meets the specific needs of each patient and helps them return to their individual lifestyle. We believe that cardiac rehab should do more to help patients return to the level of activity they previously enjoyed, for both work and play. Physicians usually have to make this decision without having much information about a patient's current physical abilities. To fill this need, Baylor Hamilton Heart and Vascular Hospital specialists in rehabilitation developed the Return to Work Lab, Live Your Action Potential. Here we focus on specificity of training. Just as athletes must train specific muscle fibers for particular sports, rehab patients must exercise or train in a way that benefits their particular job and activity level. The Return to Work Lab is equipped with a variety of equipment that allows the cardiac rehabilitation team to design a program to meet the goals of each patient. Patients describe their job or other activities, and the team sets up a training program that mimics the physical demands as closely as possible. Let's look at some examples. A landscaper needs to push a mower, and in our lab, he can. Police officers need to be able to chase down a perpetrator. A firefighter needs to carry heavy hoses up flights of stairs and needs to bust a door with an axe and pull down a ceiling and even rescue someone from a building. A golfer needs to execute a full swing. A housekeeping worker needs to be on her feet and run a vacuum. A maintenance worker needs to lift items onto a shelf and needs to push a dumpster. A soccer player needs to be able to kick a ball. A gardener needs to dig a hole. A grandmother needs to be able to pick up her grandchild. Our cardiac rehabilitation team encourages each patient to work to their full potential so they can appreciate what they can accomplish and return to their daily lives with confidence. While many patients may be comfortable working out at a local health club, Baylor Hamilton Heart and Vascular Hospital Cardiac Rehabilitation offers numerous additional benefits. Patients are frequently fearful to begin an exercise training program after a heart attack or heart surgery. Patients are monitored during exercise training through use of a cardiac telemetry system. In addition to exercise training, a multidisciplinary staff assists patients with psychosocial and nutrition counseling. Patients learn how to take their pulse, determine their individual exercise intensity, and train at a level that allows them to receive maximum benefits. Closely monitored by the clinical team, patients' confidence builds as they progress through the program.
Back off. Stop. Back up.
Baylor Hamilton Heart and Vascular Hospital's Return to Work Lab is nationally certified by the American Association of Cardiovascular and Pulmonary Rehabilitation. Our lab is a liaison between patients who want to return to work and their physician. For a physician referral or for more information about our health services, call 1-800-4-BAYLOR or visit us online at www.baylorhearthospital.com. The Return to Work Lab. Live your action potential.